Welcome back to the New York State Department of Health Clinical Education Initiative's Building Blocks for Trans and Gender Diverse Care series. I'm Erica Bostic, my pronouns are she and her, and I'm an adolescent medicine physician and faculty for the CEI Sexual Health Center of Excellence.
And I'm Kai. My pronouns are he and him, and I'm a clinical educator with CEI.
The next 3 videos are going to focus on transition. We've covered language, terminology, the basics of clinical care for trans people. Now we're going to focus on the specific kinds of medical care that trans folks may or may not seek for transition.
To start, let's take a look back at that menu we brought up a few episodes ago. This is an overview of what transition might look like, but it's not exhaustive, nor is it a prescription. Everyone's transition looks a little different. Some people might choose a little bit from one column, some people might choose some options from multiple columns, and some people don't feel the need to do any of this stuff in order to live as their authentic selves. It's a very personalized journey. Let's start with the social transition column. Social transition is, as it sounds, what you do to transition so that the people you encounter on a daily basis understand who you are a bit better. So for example, you might decide that the name you were given at birth doesn't quite jive with who you really are. And so you might pick a different name, an affirmed name, a name that better represents who you are in terms of your gender. Similarly, you might choose different pronouns. For example, as I've said in all of these videos, my pronouns are he, him, because in our society, he, him pronouns are associated with people who identify as men. You might also have to have some difficult and maybe really wonderful conversations with your friends and family to explain to them how you feel about your gender identity so that they can better understand you better and treat you more appropriately. Social transition also means that you go and buy out some new clothes. You might decide to dress a little bit more in line with how you feel inside. The next column over is the legal column. And this one's a little bit trickier. The social transition is stuff that, for the most part, you can do all on your own. It's pretty DIY. Legal, on the other hand, now that involves the court system. And it means that you might have to interact with some institutions that may or may not be comfortable for you. For example, you might go down to the DMV and change the name and gender marker on your driver's license. This means that the government understands your new name and your new gender marker.
Medical transition. This is the first time when age really does matter and will affect the next steps. People transition at any age, but depending on where someone is in their development, there may be different paths. Let's take a moment to discuss medical transition across the lifespan.
So when does a person have a concept about their gender? It might be younger than you think, around age 3. Kids can be really creative in exploring gender, which is totally normal. So if your kid or a kid in your life is exploring gender at this really early age, the best thing to do is just be supportive. Just follow their lead. Let them play around with their gender. There's absolutely no need for medical intervention at this time.
Let's say that kid explores gender and their gender persistently, insistently, and consistently is different than their sex assigned at birth, to the point where maybe they're panicking about their upcoming assigned puberty. What can we offer? Many children and families want to pursue gender-affirming hormones as a next step.
But what if you don't have it all figured out by puberty? Just asking for a friend.
No need to stress. Lots of people come to understand their true gender identity after puberty. We've developed a lot of expertise in supporting transition even after the person has completed their first puberty. Essentially, there is nothing we can push pause on more at that time, but we can give a person the hormones that will allow them to feel more affirmed in their body. We will spend 2 whole videos on these hormones, so stay tuned.
But Erica, how old is too old to transition?
It is never too late to transition. The exact amount of hormones or the type of monitoring that you need if you are transitioning at a more advanced age may be different, but it is always the right time to live authentically.
But what about the surgery?
As you so kindly pointed out in an earlier video, there is no such thing as the surgery. Just like the rest of the menu, there are a variety of surgical options that may or may not be right for individuals. It just depends on what a person's transition goals are.
For example, one of the more common gender-affirming surgeries is top surgery, which, to use medical terms, is bilateral mastectomy with masculinizing reconstruction to create a more masculine contour to the chest. This type of surgery can be really affirming for trans men or non-binary people who prefer to have a more masculine or flat chest.
Another surgical option is bottom surgery, by which people typically mean vaginoplasty, but there are others. Vaginoplasty is when a new vagina is created where a penis and scrotum had been. There are a variety of different techniques or approaches to this procedure beyond the scope of this video.
And top surgery and bottom surgery are only two of the many options out there.
So we have covered a wide variety of options to offer someone who wants to transition. We discussed how a person can begin their transition at any point in the life cycle. Before we, as a healthcare provider, can consider writing a prescription for a medication or performing a surgery, there are a few other things that we need to discuss with the patient.
The first step is to clarify goals and assess stage of development, as this will affect what options are actually available. At this point, it's really important to have an open mind and not make assumptions about the patient's goals. Some people really want to pass, meaning that they'd be able to walk around in society and have people think that they're cis. Some people don't want their gender to fit into any of society's boxes, and so for them, passing is not part of their goal. Identifying these goals is really important so you can provide medical advice and clarify expectations compared to where that person wants to go in terms of their goals. So, for example, if you've got a person who really wants to pass and thinks that they're going to do so after just 1 week on HRT, well, they're going to be disappointed. We'll talk more about timing in the next video, but suffice it to say that expectation setting is critical.
Next, the psychosocial assessment. Most people remember their first puberty as being a challenging time for various reasons. A medical transition entails inducing a second puberty. Any major life transition brings along a lot of stress, whether it's moving to a new town, starting a new job, and certainly transitioning your gender. When humans are dealing with a lot of stress, we may benefit from talking to someone to make sure that our mental health is being supported. This can be very beneficial for someone going through transition. As we discussed in the previous video, trans and gender diverse patients and people are often dealing with a lot of stigma and discrimination that can have negative impacts on mental health. This can worsen early on in transition when physical signs of transition are becoming more evident and hormone levels have not yet stabilized. I have found a lot of success when partnering with a mental health professional who is affirming of trans folks, which allows us to help the patient meet their transition goals in a healthy way. This also promotes a safe, successful, and sustainable transition.
So we've clarified our goals and expectations and assessed psychosocial needs and partnered with mental health care if necessary. If your patient would like to move forward with medically supported transition at this point, the next step is informed consent, just like for any medical or surgical procedure. However, there are some nuances when we talk about informed consent in the context of medical transition.
The goal of informed consent is to ensure that the patient has all of the information while understanding the limitations that may be present based on data that we do or do not have to make the best decision for themselves. The role of the medical provider is to share this information in an objective, honest way. It is not the role of the medical provider to decide what is best for that patient.
Historically speaking, trans people have not been in control of their own medical care. If you're interested in learning more about this, there are a lot of books and documentaries for you to review. But long story short, it's really important that we offer patients medical information pertinent to them while not standing in the way.
One thing that is always important when going through the informed consent process is reviewing risks and benefits. We will review risks and benefits associated with specific hormones in coming videos. One important thing to note is that there are risks to proceeding with medical transition, but also potentially risks with not pursuing medical transition for a patient. Reproduction. It is essential to include reproductive goals along with identifying transition goals. We know that gender-affirming hormones and gender-affirming surgeries have reproductive implications, some more well-known than others. Depending on your patient's age, stage of development, and current life circumstances, they may not be aware of things or thinking ahead of how this may impact them down the road. If someone is considering becoming a biological parent in the future, it may be useful for them to meet with a reproductive endocrinologist to better understand their options.
Also, you want to be clear about the expectations related to your practice that need to be met in order to mitigate some of the risks associated with hormones. This might include the frequency of follow-up appointments and monitoring blood work that you require. The last thing that any hormone prescriber would want is for there to be a lapse in medication due to the inability to follow through and thus not safely being able to prescribe. It's important to lay these expectations out clearly in the beginning so that everyone is on the same page.
In our next videos, we are going to jump into how we actually do this. See you soon.